Hi friends, whenever we talk about basics that every surgeon should know, the essentials that every resident should know, one of the first things that should come to your mind is how to wear the gloves and how to take them off. So this video will talk about the same. When we want to wear a glove, how do we go about it? We have to open the peel pack. Let me show you how to open the peel pack. Every peel pack is same. There are two flaps. Majority of the people open from the center. Never do that. Open from one edge, a little bit from the other one. Place your thumbs. Keep pushing and opening it up. When you're opening the gloves, make sure you have a surface where you will push it out. So this is a sterile surface on which I'll put my gloves. I'll put that away now. Now, when I have to open my gloves, this area, the next layer, the next layer, and the next layer, they all can be touched by my hands. Why are we doing it? Assuming that our hands are not sterile, although we have scrubbed them. Then we open the flaps and we stabilize the sheet of paper. I am a right-handed surgeon. I will wear the right hand glove first. The gloves have been rolled onto themselves. This area which you see on the top can be touched, not the other side because that's sterile. You hold the gloves from the inner side, hold it tight, let your fingers go in and let your thumb go in, slide inside. So you are done for the right side. These two fingers on the right side will now go to the inner folded area on the left side. You can't touch this. This is non-sterile. So you slide your two fingers in, have a grip, and that is so crucial to take it on the left side. And then put your fingers in. Adjust the gloves. You are good to operate. Do a fantastic surgery. Now, when you have to take out your gloves, this is important. Your hands can touch only this area. So you will hold the gloves and then you will slide them out without touching the inner side of the hand. Your hand is free. Now, the gloves will go on the left side. These two fingers on the right will touch the inner part of the gloves and then will roll it on the other side. So you are holding the inner side. You are done with the surgery. You have taken off your gloves. This is the time to enjoy your coffee. These are small things that are big in practice. People around you will always observe you doing these things. And your success and your decreasing the chances of infection are so much decided by how you are trained well initially. Essentials right for the first years. Thank you very much.